I will introduce Natalie. Hi, Natalie. Thanks for joining us. I'll just read some parts of her bio, but we're very grateful for you to join us and to share as the title says, Counting Counts, and I have most admired the work of the Ontario Health Coalition in scrambling to find the data about cases and deaths and impact that otherwise is not transparent. So going from Mario's comments that transparency is missing in many areas, not just in policy change areas. So Natalie has been the executive director of the Ontario Health Coalition for over 20 years. She's built the coalition into the largest and broadest public interest group on healthcare in the province, representing more than 500,000 Ontarians in its network of more than 400 member organizations and more than 50 local chapters. And she's a past board member of the Canadian Health Coalition, where she spearheaded numerous national campaigns to safeguard and improve single-tier public Medicare. The Ontario Health Coalition has been featured in research on building social movements in Canada and globally, and Natalie has been invited to consult with the Australian Labour Movement in building a health coalition network down under. She was also invited by the public physicians in the UK to help to create their version of the health coalition model. And Natalie's research reports that are cited in both popular policy and academic books, journal articles, and policy papers from a diverse array of organizations and individuals, ranging from policy advocates to journals and media to academics. Her work is frequently cited in both the Ontario Legislature and in Parliament during debates on healthcare policy and issues related to growing inequality, inequity, and social justice issues. I think maybe I'll leave it there. Maybe we'll post the rest of the bio because we want to hear from Natalie while she has time. But thank you again for taking the time to share your work.
Thank you. Thank you very much for inviting me. I'm off mute now, right?
Yep.
Okay, good.
Good.
So in the painful months and now more year of the pandemic, I've been forced personally to come to really start to think about how we value human life in our society. And I think that we have seen the most beautiful of acts of selflessness and courage and love. Sorry, it's a terrible time. And also the very worst of negligence and gross disregard for human life and human suffering and profit taking at the expense of people's lives. And so I think we all know that COVID-19 has really cast an unflinching light on all of us, and really heroic efforts have been made by public health, by public servants, public hospitals. I'm talking about healthcare in particular, thousands and thousands of healthcare workers at every level. They have demonstrated a level of sacrifice and true selflessness that really cannot be captured in words. I'm sorry. I'm half Indian, and I have 6 aunts and 56 cousins in India, and more than half of them have COVID-19 now. So they have a terrible variant spreading there. So a little bit emotional today. Also got a briefing from the hospital leadership, which I'll share with you. But so I'm sorry for being a little bit emotional. Our public healthcare system and our society, I think, have really shown extraordinary resilience after decades of planned undercapacity. And that resilience is not created by some kind of inanimate object or health policy. In fact, quite the opposite. It's been created by the people in it who have stretched themselves, who've pivoted to deal with crises and policy changes over and over now for 13 months or more, who've worked harder than they ever have before, who've braved illness, disability, and death to care for others. And with all the modern technology that we have, fundamentally, healthcare remains about human beings providing and receiving care from each other. And it is the resilience of human beings that have seen us through the crisis to the extent that we have been able to do so today. I have been so moved by all of the acts that we've witnessed of social solidarity, of care by families, communities, local businesses, our healthcare institutions. And there's just no other way to describe it than human love. I wrote these speaking notes last night in the midst of compiling data and stories about what's happening now in the third wave across Ontario. And after having received a briefing from the leadership of the hospitals across the province about the current situation, which really is the most grave that we've ever witnessed. As you likely know, hospital ICUs are full, beyond full. Today, there are 800 people in intensive care, about 1,200 people in critical care, more than 2,000 people in hospitals with COVID-19. The coroner reported yesterday that approximately 2 people per day that he knows of for the last several weeks are dying at home, never having made it to hospital before their blood oxygen levels plummeted and they perished. Across the healthcare system, lesser known about this, a massive staff redeployment is underway. It's being likened to wartime. Moving home and community care nurses, PSWs, and health professionals into hospitals to help hospital staff who are suffering under the load of desperately ill patients. Non-emergent and non-urgent surgeries are now canceled. COVID patients are being taken care of in every pocket of space in hospitals. The scope of practice for nurses and health professionals are being overridden so that people can be redeployed into units to care for patients far outside of their scope of knowledge and practice. More than 1,000 hospital patients are being offloaded from hospitals over the next week or so in order to make room for other patients. Every ICU physician or hospital nurse or health professional will tell you that the majority of patients that they're seeing now are essential workers, sick because they are required to work away from home. Some of them brought COVID home and infected entire families who are now in hospitals fighting for their lives. In the last 7 days, Ontario alone lost 199 people to COVID-19. Since the beginning of April alone, that number is 497. More than 1 person per hour is dying now. On some days, it's closer to 2 per hour in this province. I was asked to speak to you today about Lawson Lessons from the pandemic, thinking specifically about the experience of healthcare workers who lost their lives. For more than a decade, we have repeatedly raised the issue of safety and violence in long-term care, and more recently in hospitals. Workers in these sectors suffer, as you know, among the highest of work accident and injury rates in our province. For years, the issue of heavy lifting, violent residents and patients, worsening inadequacies in staffing levels, and a tolerance of these conditions that left so many damaged, disabled, hurt, and even killed while working to care for others has continued. The pandemic introduced a deadly new threat into their work. And now, more than a year in, we can see how poorly we have acted to protect them. Yesterday, I read a Facebook post on one of our family groups. It was from a PSW, a worker who was asking if COVID exposure was considered exposure if the worker was what she called full PPE. For them, today, more than a year into the pandemic, full PPE is considered a surgical mask and possibly a gown, not an N95 mask, likely not a face shield, likely not other protections. From the beginning of the pandemic, workers in long-term care have been misled, and not just long-term care, home care, hospitals across community care have been misled, confused, lied to about the level of protection needed to keep them safe. I have been deeply concerned about how inadequate levels of PPE and infection control have been normalized in long-term care. Today, if we were to survey long-term care staff, even after the second wave, in which more than half of Ontario's long-term care homes were in outbreak, in which many homes, dozens of homes, had every resident, virtually every resident, and virtually all of the staff infected, we would have to describe to them what a safe level of PPE is in order to survey them about whether or not their PPE levels are safe, because they have no idea what a safe level of PPE is for them. The failure to stockpile PPE is known, but what's lesser known is that even after the first wave, even after the summer, when both the federal and provincial governments announced they had established adequate PPE supply lines, even after the Public Health Agency of Canada finally, belatedly, in November acknowledged that COVID-19 is transmitted by small airborne droplets. Long-term care and home care staff have not been given access to N95 masks. The same conditions apply to a range of hospital workers also. I remember speaking to a person who works in a lab. She does testing for COVID-19 in the lab. In labs in Ontario, in labs and hospitals, there's no space to social distance. There is no possible way of keeping away from your coworkers, especially as they've ramped up the labs to capacities that are unheard of. Up to just before Christmas or around Christmas, they were given a surgical mask each day to wear, no N95. They were asked to take it off for their breaks, roll it up in a piece of paper towel. They all left them on the same table, side by side. They were asked to put it back on after their break, do the same thing at lunch, do the same thing in their afternoon break. They were allowed to change their mask only if that mask was visibly soiled or damaged. That's the level of rationing of surgical masks, not even N95 masks. The phlebotomists who travel through hospitals lean over patients, take the blood from the patients throughout the hospital, going from COVID hot zones to non-COVID hot zones, were required to work in surgical masks, sometimes with later with face shields, but they had to fight for access to N95 masks. In the second wave of COVID-19, we documented, to our utter horror, the spread of the virus through the long-term care homes. There is no question that the lessons from wave one were never learned, let alone the lessons from previous pandemics or epidemics. Thousands of pages of policy have been generated. There is an array of directives and guidance and policy that is really a dog's breakfast of interconnections and documents that are almost impossible to wade your way through, but they were all written with large loopholes into them. The onus for access to PPE was put squarely on the backs of workers, with a directive that said that they could not be denied access if they asked for it. The way that that directive works is that if you are a personal support worker in a long-term care home, working short-staffed on a unit without adequate access to PPE, you have to find the person that has the locked supply cabinet. You have to demand an N95 mask. You have to be put up with being considered a troublemaker in order to access an N95 mask, or booties, or gloves, or face shields, or even changes of surgical masks, and even appropriate surgical gowns or protective gowns that don't rip at the slightest touch. Cohorting and sequestering provisions to keep the infected separated. Sorry?
Okay, sorry, go ahead.
So cohorting and sequestering provisions to keep the infected separated from the healthy, to reduce worker exposure, were never enforced, and there has been no accountability, even though the provisions were written. Requirements that workers work on one site were never balanced with improved pay and full-time work, and in any case, agency workers were left out of the one-site provision. Today, there are more agency workers than ever in long-term care, and staffing shortages have never been so profound. Conditions of work and care were described to us in ghastly detail by thousands of workers and family members who contacted us, filled in our surveys, and courageously spoke out publicly through the first and second waves. And as literally hundreds of long-term care homes plunged into outbreaks, staffing crumbled, as staff got sick, the remaining staff left to try to provide care in conditions that have left them traumatized. Dozens of homes saw the virus spread in a matter of few weeks to infect virtually every resident and almost all of the staff. Many more saw 25, 50%, 75% of the residents infected and hundreds of staff. It's impossible to overstate the devastation that COVID-19 has wrought in long-term care facilities, and yet at every level, the system has failed them. Systems that were supposed to protect both residents and workers from harm have not protected them. Throughout, the Ministry and Public Health Ontario relied until December, maybe starting in early December in a small number of homes, and then later mid-December and some more in January. The Ministry and Public Health Ontario relied on telephone reports from home administrators as to the conditions in the homes. At West End Villa, for example, which is an extended care home in Ottawa, an outbreak burned on from August 30th right through to November 25th. 88 residents, including 20 who died, and 46 staff were infected. On multiple occasions, Public Health Ontario, Ottawa Public Health, and the Ministry of Long-Term Care claimed that the home had sufficient PPE, sufficient staff, and was following safety protocols. Contentions that were directly contradicted by accounts from families and staff with immediate knowledge of the situation. There is no question if inspectors had gone into the home to see what the families saw and experienced, they would have come out with quite different reports than the administrators were reporting to public health officials. On September 11th, local public health officials told the Ottawa Citizen that things had changed since the first wave and that they had ensured that West End Villa had enough PPE. The Ministry of Health told the same newspaper that they had ensured that the home had enough staff and proper outbreak protocols in place. Yet on Saturday, September 19th, the staff went to CBC to whistleblow. They spoke on condition of anonymity, fearing for their jobs, as staff working directly with residents, reporting that staff working directly with residents who have COVID-19 did not have N95 masks, something that had been raised repeatedly as a problem. The Ottawa Citizen further reported multiple claims from staff that care levels had dropped to 2 PSWs for 60 COVID positive residents. This is a shockingly low level of staffing, and it means that even the most fundamental elements of care and infection control could not possibly be done by those workers. Extended Care spokesperson is quoted in the media on September 22nd, and it is, I think, particularly disturbing. So you'll remember now we're more than half a year into the pandemic, and in response to staff reports about poor access to PPE, the spokesperson said, quote, N95 masks are not recommended for long-term care, but added, if our staff indicate that they would prefer to have an N95 mask, we make them available. Let me ask you, how do 2 PSWs charged with taking care of 60 COVID positive residents on a unit who do not have time to even change PPE between residents, seek out a manager, find the person with a key, demand an N95 mask in order to keep them protected? It's ludicrous. And I won't go on because time is getting on, but I could give you cases from Kennedy Lodge, from Tender Care, from dozens and dozens and dozens, most of them for-profit long-term care homes, in which caring conditions were such, low staffing was such that infection control was impossible and continues to be to this day, in which there was no access to appropriate PPE, in which staff were asked to work in conditions in which there was no cohorting, in which staff worked from hot zones into non-hot zones, in which residents were not protected from wandering because there wasn't enough staff to do it, in which people got infected by the thousands, literally, in preventable cases of COVID-19 that ultimately resulted in the deaths of thousands of people. Sorry, I'm skipping through to the end. At this point, across Ontario, more than 420,000 Ontarians have been infected by COVID-19. 21,422 healthcare staff, according to Public Health Ontario, have been infected. But we checked in July, and those numbers did not include PSWs because they were not tracking PSW infections through the entire first wave. We've compiled a list of the lives of the staff who died as a result of COVID-19 in long-term care and in hospitals. They are PSWs who worked, some of them for 31 years in the homes, who loved their residents, who really gave their lives to care for other people. They are environmental service workers in hospitals. They're nurses, they are cleaners. They are people whose control over their health and safety was never in their hands through the pandemic, and whose lives deserved to be protected. At the end, now we're looking at most of the infections having moved from long-term care into other workplaces where workers are still being required to go into work, even though by no stretch of the imagination is their workplace essential. In the worst of the pandemic that we have seen so far, and yet no measures have been taken by our government to narrow the list of essential workplaces, to provide adequate supports for those businesses to close and for those workers to work from home, to protect their mortgages and their ability to pay their rent, to provide proper protections in terms of their health and safety at work, and to prevent all of the needless death that we're seeing in our communities. It is horrific. We've tracked workplace outbreaks outside of healthcare since June, when the province first started to open up, and we have seen massive outbreaks. However, in Ontario, unlike in other provinces like Nova Scotia, for example, where they publish every workplace, every business that has an outbreak, most of them remain hidden. Only one local public health unit actually even reports all of the workplace outbreaks. It's Hamilton. Brant did until recently, but doesn't. Toronto reports some, Peel reports some, and the other public health units do not report the names of businesses with outbreaks. It has been difficult, I think, to build a societal consensus around the measures that are needed, because the basic background information about how the virus is being spread and where it's being spread has not been shared openly with the public. There is no clear message. Workers don't even know when there are outbreaks in their own workplaces in order to be able to take precautions on their own. And as you all know, worker health and safety precautions that are being required are not being enforced and are not adequate. Across the board, the kind of suffering and the kind of death that we've seen, as the loss that we've seen as a result of COVID-19, on the kind of scale that we've seen, is it creates its own kind of moral obligation. It creates its own duty. It requires us to say never again in a way that really does profoundly change how we treat the value of life, the value of workers, the value of patients and residents, the value of profit over human life. And I'm really pleased to have been able to join you today in your tremendous work to say never again. Thank you.
Oh, thank you, Natalie. That was very powerful, but very sad reflection on all the impact in long-term care, residential healthcare, and, as you say, into so many other workplaces that we still don't even know entirely about it, except for seeing them now by virtue of the case numbers getting to hospital. So I really appreciate you taking the time to share that. Someone did ask if you would be willing to share your notes or anything like that. If you've got them in writing, we'd be happy to post them, but of course that's up to you. So if you're
Sure, I'd be happy to. Sure.
Yeah, that would be great. I'm not sure if you can stay for any questions. Mostly they've been, thanks for your work and how disturbing, and of course, so also so sorry about what your family's dealing with in India, and hopefully some of the knowledge from here, and I don't know if it can make a difference back and forth across the world. We've been working with people from other countries, and that is, the world has been made smaller between a lot of us in the process of all this, a small silver lining. And there is a quick question here from Dorothy. What can others do to support the coalition's work at the moment?
Yeah, so on Monday, either Monday or Wednesday, we're just trying to pull it together. We're going to put out the latest report on where the spread of COVID-19 is happening. So industry by industry, every sort of outbreak that we've been able to find out from our networks across the province, and report them, and call for full public reporting of all workplace outbreaks. We're going to have the Nova Scotia Health Coalition co-chair on. I'm just consulting with my board this afternoon about this, but hopefully call for narrowing of the number of essential workplaces that are opening, the closure of workplaces that are not essential workplaces with full protections, and of course, much enhanced health and safety protections and a much clearer public health message. So to whatever extent you can help to amplify that. And then we'll also be talking, really trying to paint a picture for Ontarians, which I don't think is really out there in the way that it needs to be, about what is happening, that the real crisis that our healthcare system is in. We are now triaging in ways that will mean that people will die as a result of not accessing care, and it's getting worse. And so employers, you know, any employer requiring people to go to work when they don't need to go into a work site should not, it's reckless, it's endangering their lives, it shouldn't happen. So we need to get that message out as far as possible. So any amplification of that, we'll be posting it all, you know, putting it out on our listservs and our social media, and we'll also be doing a press conference. Tuesday, we're doing a national day of action to improve standards in long-term care. It's rolling across the country. It's on Facebook. And then we'll be responding to the Long-Term Care COVID-19 Commission report, which is coming out likely on Friday. It's not clear how it's coming out, but it's due on the 30th. So any amplification of those things. And of course, we have a network of local coalitions across the province. People, if they want to join them, it's all on our website, and we'll be happy to keep in touch with you about all of those things. And sorry, I do actually have a meeting that started at 2 with our long-term care committee to try to organize all of this. So I'm so sorry to just be in and out to speak. It's rude. I don't mean to be rude. And just really appreciate the invitation.
We'll say we appreciate you carving time out of your busy day. So Tim told us that he sometimes has seen you give interviews in the midst of other interviews. So we're happy to have had your dedicated time for half an hour. We really appreciate it. And yeah, we'll be in touch about getting the your notes to post, and of course the video will be posted. And this, yes, if there's any events that we can share by social media and other things that are coming up in the next week and months, just let us know. So thank you very much. And maybe we'll have you back when we can count the diminishing numbers. That's what we all want to get to, right?
Yes.
And your work, I think, will contribute to that. So thank you,
I
Natalie.
hope so. Thank you very much.
Yeah.
Bye now.
Take care.